All right, so here's a little story for you. So John and Carrie are an African-American couple who have been married for about 8 years. And they look healthy, they look strong, they look happy, wonderful couple. Although they live a very normal life, they both actually carry the sickle cell anemia trait. Now, the couple is expecting a baby girl. Before conceiving, the couple learned that there was a chance that their baby would be born with sickle cell anemia. Of course, they were really nervous about it. So if you and your partner have sickle cell trait, your child has 25% chance of being born with sickle cell anemia. If only one of you has sickle cell trait, your child won't be born with sickle cell anemia, but there is a 50% chance that your child will be born with sickle cell trait. I hope I made sense. The second month of pregnancy, Carrie goes and sees her doctor, and the doctor, a sample of the amniotic fluid and tissue from the placenta were examined for signs of sickle cell hemoglobin gene that causes the condition. It did turn out that the baby girl did have sickle cell anemia. Months later, a baby girl named Kayla was born. She was strong, latched well, slept well, and she was just beautiful. The couple were happy and excited, but then deep down, they had to remind themselves that there will be a lot of emotional strain, sleepless night. There will be days that they will just feel like it's challenging, but they knew they would have to take one day at a time, and no matter what, their baby would be loved unconditionally. Months go by after sleepless nights. Kayla is now 8 months old. One particular night around 2 o'clock in the morning, she woke up and she was just screaming hysterically. She was pale, her body was hot, she started vomiting all over, she was breathing so fast, her hands and feet were swollen. Her parents were like freaking out, but then they knew exactly what was going on. They rushed Kayla to the hospital, and it happened that she was experiencing a sickle cell crisis. Treatment was provided and the family returned home. Fast forward, Kayla is now 12 years old with a capacity to understand her medical condition. She's ready and would like to learn more about sickle cell anemia. So I feel like a lot of people out there don't really understand the sickle cell anemia is very painful. If you have it, of course, you need to learn, you need to understand so that you're able to take care of yourself. Sickle cell anemia is a condition in which the red blood cells are not shaped as they should be. Red blood cells normally look like a round disc, but in sickle cell disease, they are actually shaped like sickles or crescent moons instead. They're stiff and sticky, and they tend to block small blood vessels when they get stuck together. So this stops the blood from moving as it should, which can lead to pain and organ damage. Signs and symptoms of sickle cell anemia usually appears around 6 months of age. They do vary from person to person and may change over time. These individuals are usually very tired because their hemoglobin is low, so therefore they have lower oxygen amount in their body, causing them to be more fatigued. Periodic episodes of extreme pain called pain crisis. These pains are horrible. This can go from chest pain, abdominal pain, joint pain, trouble breathing, coughing, and stroke as well. Now, the pain varies in intensity and can last for a few hours to a few days. Some people have only a few pain crises a year. Others have a dozen or more a year. A severe pain crisis requires a hospital stay. Some people have swelling of hands and feet, frequent infections, delayed growth, or puberty, as well as vision problems. Sickle cell disease and sickle cell trait usually are found at birth with blood tests during routine newborn screening. A blood test called hemoglobin electrophoresis will confirm the diagnosis. Sickle cell disease, it's actually inherited, all right? So kids are born with sickle cell disease when both parents pass along the sickle cell gene to their children. Treatment management of sickle cell anemia usually is aimed at avoiding pain crises, relieving symptoms and preventing complications. Treatment might include medications and blood transfusion. For some children and teenagers, a stem cell transplant might cure the disease. Tips to prevent crisis. You want to drink plenty of water, dress warmly in cold weather, and carry an extra layer just in case. Avoid mountain climbing. Stick to light to moderate exercise. Pay attention to your stress level as well. Wash your hands to avoid infections because you are prone to being infected. You want to also avoid taking alcohol, tobacco products, take folic supplements to prevent anemia, and only travel in commercial planes. If you're planning to travel, do talk to your doctor before traveling. Now, question for you. So John and Carrie are considering to have another child. Do you think this couple should continue to have children or just have the one child? Let me know in the comments. Thank you for watching, and I'll see you next time. Bye.